Okay, so today we're going to dig into the spine, but not just the bones and discs. We're talking about the surprising science of what a spinal adjustment actually does to your brain and your body. Let's get right into it.
You know that sound, right? That really distinct pop or crack. Maybe you've even felt it yourself. But have you ever stopped to think what's really going on in that moment? Like, what's happening physically and neurologically? Well, the answer? It's probably not what you're thinking. For the longest time, the idea was super simple, right? A bone slips out of place, it pinches or squashes a nerve, and bam, that's your problem. It's a really clean, mechanical idea, and it makes sense. But the science has totally moved on from that. And that's the absolute key here, this huge shift in thinking. We've gone from that old squashed nerve idea to something way more fascinating. It's a neurological model. So think about it this way. It's not a plumbing problem anymore, it's a communication problem. We're talking about a faulty signal between your spine and your brain. Okay, so let's really unpack this communication problem. The real issue isn't some bone physically blocking a nerve. Nope. It's about garbled, distorted information getting sent from your spine up to your central nervous system. Now, there's a fancy scientific name for this, of course. It's called a Central Segmental Motor Control problem, or a CSMC problem for short. I know, it's a mouthful. But all it really means is that a little piece of your spine isn't moving the way it should. And because of that, it's constantly sending bad data, just junk information, up to your brain. The best analogy? It's like static on a phone line, just messing up the conversation and making it really hard for your brain to control your muscles the right way. And look, this isn't some abstract theory. A CSMC problem feels like something. It has real, you can feel it, symptoms. You know those muscles that are just always tight, no matter what you do? Or that feeling of stiffness, where you just can't move a part of your back or neck freely? And those specific spots that are super tender to the touch? Yep, that's what we're talking about. Okay, so if the problem is a bad signal, a faulty communication line, how do you fix it? Well, that's where the adjustment comes in. But here's the big mind shift. Don't think of it as just pushing a bone back into place. Think of it as a targeted neural reboot, like hitting Control-Alt-Delete for your nervous system. So here's the play-by-play. Your brain has this internal map of your body, right? Its own little GPS. When it starts getting that bad, static-filled data from the spine, the map gets, well, blurry and inaccurate. An adjustment delivers this sudden, super fast, powerful burst of good, accurate sensory information. It basically forces the brain to go, whoa, okay, let's update that map. And once the map is clearer, what happens? You get way better control and coordination of your muscles. That specific reboot action, it's called a high-velocity, low-amplitude thrust, or HVLA. It's just a really quick, really precise movement. And it's designed to do one thing and one thing only: bombard the nervous system with a huge blast of positive, high-quality information from all the little sensors in and around that joint. All right, so this all sounds fascinating, right? A neural reboot? But does it actually do anything? Can you measure the effects? The research is pointing to a pretty emphatic yes. So let's actually look at some of the data. Just take a look at this number. Let it sink in for a second. 64.2%. So what is that? That's the average increase in leg muscle strength for chronic stroke patients after just one single session of spinal adjustments. I mean, think about that for a second. These are people whose brain-to-body communication is seriously compromised, and yet this one intervention created a massive, almost immediate improvement in how much force they could generate. It's kind of mind-blowing. So how is that even possible? Well, this chart here shows something called the V wave. It's basically a way to measure the strength of the signal going from the brain down to the muscle, what scientists call cortical drive. And as you can see, plain as day, after an adjustment, that drive gets a huge boost. The brain just gets way, way better at telling the muscle what to do. And it's not just stroke patients, not by a long shot. This effect shows up in all sorts of different people. We're talking elite taekwondo athletes getting a strength boost. People with that annoying, nagging, low-level back pain, they see a 16% increase. It even helps with really specific things like improving quad strength in people with knee pain, or even changing pelvic floor muscle tone for pregnant women. It's incredibly widespread. So all of this really brings us to the big picture, doesn't it? We have to stop thinking about the spine as just a stack of bones holding us up. It's so much more than that. It's a massive sensory organ, constantly feeding a torrent of information to your brain. It's a critical part of your body's entire operating system.
You know, the European Journal of Applied Physiology actually summed it up perfectly. They said, and I'm quoting here, that spinal adjustments appear to improve the accuracy of the brain's inner body map. That's it, right there. It's fundamentally about giving the brain a better, clearer picture of the body it's trying to control. So, if there's one thing to take away from all this, it's this. Spinal health is not just about posture, it's not just about standing up straight, it is all about the quality of the conversation happening between your body and your brain. And when you make sure your brain has the cleanest, most accurate information to work with, it can control everything so much more effectively. And that really leaves us with one final big question to think about, doesn't it? If that communication line between your brain and your body does have static in terms of your strength, your coordination, your overall performance, what are you leaving on the table?